Radiation therapy is one of the safest, most effective tools in cancer treatment today. It may be used to reduce the size of a tumor before surgery, or to destroy any remaining cancer cells after surgery. It may also be used as your primary treatment course, or in conjunction with chemotherapy.
There are two different types of radiation. One where the radiation source is actually placed within the patient next to the tumor or in a cavity where a tumor once was. That is referred to as brachytherapy. Alternatively, radiation can be delivered from the outside or from a linear accelerator or machine. That is referred to as teletherapy.
Teletherapy uses high-energy radiation beams precisely directed at your cancer cells to maximize treatment effectiveness with minimum damage to normal tissues.
Most commonly, patients are treated once a day, 5 days a week for anywhere from 2 to 9 weeks.
Some highly specialized techniques use higher doses of radiation delivered in a more targeted fashion over fewer treatments, minimizing the severity of side effects even further. Your radiation treatment process consists of 4 basic steps: simulation, planning, preparation, and treatment.
After a patient is consulted by the doctor, they'll come in for what we call a simulation. And that's where we position the patient and they do a CT scan where they're able to localize the tumor.
Your radiation therapist uses reference markers and immobilization devices to make sure you're positioned for the best angle of treatment. The CT scan obtains a high-resolution 3D image of the anatomical region to be treated. These images will be used in the planning phase. After your simulation appointment, your medical physicist and dosimetrist work closely with your radiation oncologist using advanced computer software to plan the sequence of radiation beams and calibrate the radiation dose. Using Mosaic software, your treatment team can manage dosage calculations and administration with built-in safeguards that support safe and accurate treatments. This complex planning process may take several days before you will return for your first treatment appointment. Before each treatment session, another set of images is taken to compare with the initial scan. This step helps verify that every detail is correct before beginning your radiation treatment. Once preparation is complete, treatment begins.
The new Elekta equipment is extremely accurate. You're diminishing a lot of the side effects that we had years ago because you don't have to blast a lot of the area that might be right next to the tumor that you're treating.
During radiation, you can easily communicate with your treatment team.
We have an intercom system, so we could hear you. We're watching you the whole time on a closed-circuit TV. If you need to say something to us, we can hear you and speak back.
They always made sure I was comfortable. I worked through my entire radiation treatment. I never felt the fatigue, and I literally jumped right out of my radiation treatment. I went right to the gym afterwards.
The actual time the beam is on, delivering radiation, adds up to less than a few minutes. However, you may be in the treatment room anywhere from 10 to 40 minutes, depending on the complexity of your treatment and preparation.
So we've got image-guided radiation therapy. We actually take images both before and during treatment to ensure that the position of the patient is right on, as well as we can see the tumor and how it's changing from one fraction of treatment to the next.
With multiple built-in equipment and software safeguards, radiation therapy is used to treat hundreds of thousands of patients safely each year.